This bill is being written entirely along partisan lines without any attempt to bring Democrats on board. And the American people deserve better. This bill is being written and rushed through the Senate with hardly any time to debate the cost or the details of this proposal. And the American people deserve better. Now, I remember when our colleagues across the aisle said the Affordable Care Act was being rammed down the American people's throats in the middle of the night. Well, the ACA went, in fact, through 106 public hearings. It incorporated more than 170 Republican amendments. The whole process took an entire year. But this health care plan involves no hearings, no bill text, and no transparency at all. As United States Senators, we were sent here to represent the American people. Represent the American people. We answer to the American people. So why are my colleagues from across the aisle trying to put one over on the American people? I've met folks all across California and this country, and they see what's happening. They know that if this bill were as wonderful as its proponents would like us to believe, it would be out in the open. The American people deserve greater transparency. But even though the authors of this proposal have tried to conceal the details of their plan, we know enough to know this bill would be nothing short of a disaster. We know, because we've been told, that it's about 80% the same as the bill that was passed by the House, a bill so catastrophic that even the President of the United States, who hailed its passage, now calls it, quote, mean. We know that it would throw 23 million Americans off their health insurance within a decade, including putting 4 to 5 million Californians at risk of losing coverage. We know it would raise costs for middle-class families and seniors. In every county of California, average monthly premium costs would go up, while financial support to pay premiums would fall. We know it would put Americans with pre-existing conditions at risk and leave people who need maternity care or opioid treatment without coverage or force them to pay huge out-of-pocket costs. We know it would cut about $834 billion from Medicaid, which means less money for families to pay for nursing homes, to support children with special needs, or to treat substance abuse. Bless you. And that is another reason we need the Affordable Care Act to be in place in a way that we fix what's wrong, but we mend what's broken and not repeal it altogether. I recently visited, Mr. President, a really remarkable treatment clinic in Los Angeles. It's called the Martin Luther King Jr. Outpatient Center. Everyone from the doctors to the patients can tell you that when 46,000 Californians, 4,600 Californians are dying every year from substance abuse and opioid overdoses, it is wrong and irrational to cut Medicaid. So it really makes you wonder, why would anyone support this bill? How does this bill help real people with real challenges? At a healthcare rally in Los Angeles back in January, I met a woman named Tanya. Before the ACA, she'd sign up for insurance just long enough to see a doctor. She'd then have a few tests done and fill a prescription. Then she would realize she couldn't pay and couldn't afford to pay for the insurance beyond that. And she said it's, quote, the worst feeling in the world to have to tell your doctor, who is trying to make you well, that you cannot afford the treatment prescribed. Tanya told me, quote, before the Affordable Care Act, living without health coverage was a nightmare in this country. But she went on to say that has all changed. And thanks to the ACA, I can now see a doctor when I need to, monitor my condition, and stay healthy so I can keep working and contribute to our nation's economy. If my colleagues in Congress, and she referred to them as if the Republicans in Congress repeal the law, I don't know what I will do. So I ask, how does the Republican health care plan help Tanya?
This is a bill that would provide over $200 billion in tax breaks to the top 2%. This is a bill that would provide hundreds of billions of dollars in tax breaks for the drug companies and the insurance companies. Last information I received, pharmaceutical industry, the major 5 drug companies made over $50 billion in profit. But this legislation would throw Americans off of health insurance to give the drug companies even more profit. This legislation, the House bill, and I think similarly the bill being worked on behind closed doors, is not only opposed by the AARP, the largest senior group in America, it is opposed by the American Cancer Society, by the American Heart Association, by the American Lung Association, the Cystic Fibrosis Foundation, the March of Dimes, the National MS Society, the American Medical Association, because the doctors know what a disaster this will be for health care for millions of Americans, the American Nurses Association, and the American Hospital Association. So you got all of these groups who are the pillars of health care in America saying, no, no, this is a disastrous bill, and yet we have the Republican leadership and a dozen or so members working behind closed doors. Now, Mr. President, nobody here has suggested that the Affordable Care Act should not be improved. In my view, it should be improved. In my view, deductibles are too high, co-payments are too high, premiums are too high, and certainly the fact that we're paying twice as much as any other country for prescription drugs, that has got to be dealt with also. So the task right now among sensible people is to put on the table and to be honest about it. What are the problems of the Affordable Care Act? How do we lower deductibles? How do we lower co-payments? How do we control escalating costs of health care? Those are reasonable questions that honest people should debate. But the answer is not to throw 23 million Americans off of health insurance. That is not a solution to the problem. That is an insult to the American people. Let me just conclude by stating this. Our job right now is to make sure that this disastrous Republican proposal never sees the light of day. And I would urge my Democratic colleagues, on behalf of the American people, the vast majority of whom know how bad this legislation is, that we have got to stand up and fight in an unprecedented way to make sure that that legislation never sees the light of day. And after we win that struggle, I would hope that we would come forward as a nation and join every other major country on earth, whether it's Canada, and I live 50 miles away from the Canadian border, whether it's the United Kingdom, France, Germany, that we would join every other major nation on earth and say that health care is a right of all people, not a privilege. If you are an American, you are entitled to health care. You should not be one of the 23 million people thrown off of health care, bringing the total of uninsured in America over 50 million people. That is outrageous. So, Mr. President, I think you're going to hear the American people stand up loudly and clearly, demand transparency, demand serious debate on an issue of this consequence, and I think at the end of the day, this legislation will be defeated. Thank you, and I will yield the floor.
Mr. President.
Senator from Washington.
Mr. President, Democrats come to the floor this evening as a voice for the people that we represent, to fight back against Republican plans to jam Trump care through this Senate, increase health care costs, and hurt families across the country. Because Republican leaders may hope nobody pays attention, they can hope they can go into these secret rooms and cut secret deals and come out with a Trump care bill that they can jam through before anybody notices. We are not going to allow that to happen. We are here. We're going to fight back, and I can only hope that just a few Republicans decide to listen to their constituents, reverse course, and work with us to improve health care instead of standing with President Trump to destroy it.
Kamala.